1 in 3 people watching this video right now has a condition that is quietly damaging their blood vessels, their nerves, their kidneys, and their eyes. Most of them have no idea, not because the condition is invisible, but because the warning signs are easy to dismiss. Frequent trips to the bathroom, feeling tired all the time, headaches, dry mouth, things we blame on stress, on poor sleep, on getting older. But here is what nobody tells you. Your body has been sending signals for years, specific, measurable, biological signals. And if you know what to look for, you can catch this early enough to reverse it completely. Today I'm going to give you that knowledge. I'm James Mercer, and welcome to the Longevity Tip. In this video, you're going to understand exactly what happens inside your body when blood sugar stays too high for too long. You'll learn the early warning signs, the ones that appear years before a diagnosis, and why your body produces them. You'll also find out who is most at risk, what the numbers actually mean, and what you can do about it right now. Let's get into it. Here is a number that should stop you in your tracks. 1 in 3 people on this planet currently has prediabetes, and 1 in 10 has full type 2 diabetes. That's roughly 800 million people worldwide. And here is the part that makes this truly dangerous. Nearly half of those people don't know they have it. This isn't a rare condition that happens to other people. Statistically, if you're sitting in a room with 2 other people right now, one of you is affected. So why don't people know? Because high blood sugar, what doctors call hyperglycemia, is what we call a silent condition. In the early stages, it produces no dramatic symptoms, no sudden pain, no obvious warning, just a slow, quiet process of damage happening underneath the surface. Here is how it works. Every time you eat, carbohydrates are broken down into glucose, sugar, and that sugar enters your bloodstream. Your body then releases insulin, a hormone whose job is to escort that glucose out of your blood and into your cells where it's used for energy. This is a perfectly normal, healthy process that happens thousands of times throughout your life. The problem begins when something disrupts this system. In prediabetes and type 2 diabetes, your cells gradually become resistant to insulin. They stop responding to its signals, so glucose can't get in, it stays in your bloodstream instead, circulating at higher and higher concentrations. And here is where the damage begins. Because glucose at high concentrations is toxic to blood vessels, it slowly destroys them from the inside out. This is why diabetes affects so many organs. Your eyes, your kidneys, your heart, your nerves, they all depend on healthy blood vessels. And when those vessels are damaged by years of excess sugar, everything downstream suffers. Understanding this one mechanism, insulin resistance, and its effect on blood vessels, is the key to understanding every symptom we're about to cover. Each warning sign your body produces is a direct consequence of this process. Once you understand the mechanism, the symptoms stop being random. They start making perfect sense. Now let's talk about what your body is actually trying to tell you. These are the signals that appear in the early stages, sometimes years before a formal diagnosis. Most people ignore them. After this video, you won't. The first sign is one that almost everyone dismisses as insignificant. You start going to the bathroom more often than usual. Maybe you're waking up once or twice at night. Maybe you're making more trips during the day. People blame it on drinking too much coffee or just getting older, but here is what's actually happening. When your blood sugar rises above a certain threshold, your kidneys go into emergency mode. Their job is to filter your blood and keep what's useful. But when there's too much glucose circulating, they can't reabsorb all of it. So they do the only thing they can. They flush the excess glucose out through your urine, and glucose pulls water with it. This is why people with high blood sugar can produce more than 2.5 liters of urine per day. Their kidneys are working overtime, trying to clean up a problem that keeps returning with every meal, which brings us directly to the next sign. When your body loses that much fluid through frequent urination, it becomes dehydrated. Your brain registers the drop in fluid levels and triggers intense thirst. You drink, you urinate more, you become thirsty again. It becomes a cycle. The frustrating part is that this thirst often cannot be satisfied. You drink a glass of water and feel thirsty again 20 minutes later. That's because the underlying cause, the excess glucose driving urinary losses, hasn't been addressed. An important note here, when this thirst hits, the instinct for many people is to reach for juice, soda, or sports drinks. This makes things dramatically worse. The added sugar accelerates the very cycle you're trying to escape. Plain water is the only right answer. The third sign is perhaps the most misunderstood symptom of all. You feel exhausted, not the kind of tired that goes away after a good night's sleep, a deep, persistent fatigue that's there when you wake up and follows you through the day. Most people blame stress, poor sleep, or simply the demands of modern life, but here is the biological reality. Your cells are starving, not because there's no food available. There's actually glucose everywhere, circulating in excess in your blood, but because of insulin resistance, your cells can't access it. The doors are locked. The glucose is right outside, but it can't get in. So your cells send distress signals. They have no fuel. Your body experiences this as profound exhaustion, even when you've slept 8 hours and eaten a full meal. This is one of the most telling signs, precisely because it doesn't go away with rest. If you're experiencing fatigue that doesn't respond to sleep, that's your body telling you something deeper is wrong. Closely related to fatigue is intense, uncontrollable hunger. Here's the mechanism. When your cells can't absorb glucose, your pancreas responds by producing more insulin, trying to force the glucose into resistant cells. This surge of insulin can sometimes overcorrect, causing blood sugar to drop sharply. And when blood sugar drops, your brain sounds the alarm. It triggers intense hunger, demanding more food immediately. So you eat. Blood sugar rises again. The cycle repeats. What makes this particularly deceptive is that the hunger often doesn't go away even after eating. You finish a full meal and feel hungry again within an hour. This isn't a psychological issue or a lack of willpower. It's a direct consequence of the metabolic dysfunction happening in your cells. As dehydration from frequent urination takes hold, the brain is one of the first organs to feel it. Even mild dehydration, a loss of just 1 or 2% of your body's water, is enough to impair cognitive function. You may experience dull, persistent headaches that don't respond well to pain relief. You may find it harder to concentrate, to remember things, to stay focused on tasks. But dehydration is only part of the story. High blood sugar also directly disrupts the function of neurotransmitters, the chemical messengers your brain uses to communicate. It causes swelling and narrowing of blood vessels in the brain, and over time it begins to damage the delicate nerve cells themselves. This is why people with chronically elevated blood sugar often describe what they call brain fog, a persistent sense of mental cloudiness that they can't quite explain. Many spend years attributing it to stress or aging, never suspecting that the root cause is circulating in their bloodstream. 2 more early signs that are frequently overlooked. The first is persistent dry mouth, not just morning dryness, but a constant feeling of dryness throughout the day, a rough coated tongue, cracked lips, a burning sensation in the mouth, sometimes difficulty swallowing or speaking. Research confirms that high blood sugar directly impairs the salivary glands, reducing saliva production significantly. The second is changes to the skin. People with elevated blood sugar often notice increased itching, skin that heals slowly from minor scratches, and sometimes a darkening of the skin, particularly in the folds of the neck, armpits, and groin. This darkening is caused by excess insulin stimulating skin cells to overproduce. If you notice it, it's a meaningful signal worth investigating. High blood sugar impairs the immune system in multiple ways. It reduces the ability of white blood cells to respond to pathogens. It promotes bacterial and fungal growth because bacteria and fungi thrive on glucose. And it damages the tiny blood vessels that carry immune cells to sites of infection or injury. The result? People with elevated blood sugar get sick more often, stay sick longer, and heal more slowly. Urinary tract infections become more common. Because glucose in the urine is essentially food for bacteria, women may notice recurrent vaginal yeast infections. Minor cuts and scrapes that should heal in days take weeks instead. If you've noticed that you seem to catch everything that goes around, and that wounds seem to take longer to heal than they used to, this is worth paying attention to. Each of these 7 signs tells the same story from a different angle. frequent urination, thirst, fatigue, hunger, headaches, dry mouth, slow healing. They are all consequences of the same underlying process: glucose accumulating in the blood, unable to reach the cells that need it, and slowly damaging everything in its path. None of these signs alone is diagnostic, but taken together, especially if several are present at the same time, they represent a pattern that deserves attention and action. Here is a number that matters more than almost anything else in this conversation. Blood sugar is measured in milligrams per deciliter. Here's what the numbers mean. Between 72 and 99 milligrams per deciliter, when fasting, this is normal, your body is handling glucose efficiently. Between 100 and 125 milligrams per deciliter, when fasting, this is prediabetes. Your cells are beginning to show insulin resistance. At this stage, the condition is often fully reversible with lifestyle changes. Above 125 milligrams per deciliter, when fasting, confirmed on 2 separate tests, this meets the clinical threshold for type 2 diabetes. The critical point here is the middle range. Prediabetes is where the window of opportunity exists. The damage is beginning, but it hasn't progressed far enough to be permanent. People who catch themselves in this range and make meaningful changes can normalize their blood sugar entirely. But most people in this range have no idea they're there. They feel fine, the symptoms are subtle, and they haven't been tested. Now let's talk about who is most likely to find themselves in that dangerous middle range. Excess body weight is the strongest modifiable risk factor, particularly fat stored around the abdomen, which is metabolically active and promotes insulin resistance directly. Physical inactivity compounds the problem significantly. Muscle tissue is the largest consumer of glucose in your body. When you're sedentary, your muscles aren't using glucose efficiently, which means it stays in your blood at higher concentrations. Family history matters. If a parent or sibling has type 2 diabetes, your risk is significantly elevated, not because your fate is determined, but because you may have inherited a tendency toward insulin resistance that requires more careful management. High blood pressure and elevated triglycerides are both strongly associated with insulin resistance. They often appear together as part of what's called metabolic syndrome, a cluster of conditions that significantly increases the risk of diabetes, heart disease, and stroke. For women, polycystic ovary syndrome, PCOS, is strongly linked to insulin resistance and elevated diabetes risk, often appearing years before any blood sugar abnormality shows up on a standard test. A diet high in refined carbohydrates and added sugars drives repeated blood sugar spikes that, over time, exhaust the insulin response and accelerate the development of insulin resistance. Finally, smoking and heavy alcohol consumption both directly impair insulin sensitivity in ways that are measurable and significant. Here is the most important thing to understand about this entire list. Almost every single factor on it is modifiable. With the exception of family history, every item responds to lifestyle intervention. This is not a condition you are helpless against. The tools to prevent and reverse prediabetes are available to everyone, and they don't require expensive medications or complex medical procedures. If you've recognized any of these signs in yourself, or if you fall into one or more of the risk categories, there is one immediate action that matters more than anything else. Get your fasting blood glucose tested. This is one of the most commonly available, affordable medical tests in the world. A simple blood draw taken after an overnight fast. The results tell you exactly where your blood sugar stands. And knowing where you stand is the foundation of everything else. If your number is normal, great. Now you know. Test again in a year. If your number is in the pre-diabetic range, this is actually good news, even though it might not feel that way. You've caught something early. The research is clear that people in this range who make consistent lifestyle changes, improving diet quality, increasing physical activity, managing sleep, can normalize their blood sugar and significantly reduce their lifetime risk of developing type 2 diabetes. If your number indicates diabetes, you now have information that allows you to work with a healthcare professional to create a plan. Early intervention changes outcomes dramatically. The worst scenario is not knowing, and the only reason not to know is not getting tested. Your body has been communicating with you. Every sign we covered today, the fatigue, the thirst, the frequent urination, the slow healing, is your biology speaking a language. Today you learned to read it. One blood test, one number. That's the starting point. 1 in 3 people has prediabetes right now. Half of all people with diabetes don't know they have it. And the early warning signs, the ones we covered today, appear years before things become serious. You now know what those signs are, what they mean, and what's actually happening in your body when they appear. The next step is simple. If you haven't had your blood sugar tested recently, schedule it. It takes 10 minutes, and it could be one of the most important things you do for your long-term health. If this video helped you, please leave a like and subscribe this channel so you won't miss another The Longevity Tip video. I'm James Mercer. I'll see you there.